The sex professor.
The sex professor.
How did you come about being the sex professor?
I've always had a a history of being interested in sex, as doing sex, having sex, all kinds of sex. But also, it's a way I've kind of come into myself. And then I most recently, in the past decade, have gotten really interested in doing research on Black gay man sexuality, particularly looking at HIV. I entered into the world of sex research into HIV prevention,
Mm,
but I realized that the discussions about Black gay man sexuality overly emphasize HIV and not about pleasure.
mm,
And so I've been interested in how Black gay men experience pleasure, pursue sexual pleasure. What is the meaning of sex
mm.
in our lives? How does it function? What kind of sex we like to have? And what are some of the ways in which the current, discussions about Black gay man sexuality and HIV limit the possibilities for sex?
Mm. So that's just a taste of what we're going to be talking about this evening. So you might want to put the kitties away. We're going to talk about some pretty intense subject matter. But if you're watching us on Facebook, please be sure to like us on Facebook. If you're watching us on YouTube, please subscribe to our YouTube channel. And please go to our website, thecounternarrative.org, and join our email list so you can stay in the loop of all things counter narrative. This is going to be a really exciting show because we're going to talk about sexuality very explicitly. As revolutionary health is about health, but health from a holistic perspective. So we get a chance to talk about sexuality, but we're also going to talk about health. We're going to talk about pleasure, and I think we're going to talk about sexuality in some ways that we may not. As Black gay men, we don't always get the opportunity to talk about sexuality. So it's going to be a pretty candid discussion. And I see some folks are liking us. So again, please like us on Facebook. I see some folks joining. And also in the comments, let us know what you think. Let us know about some of your thoughts and feelings about. And I know tonight we're going to actually be talking a lot about condomless sex.
Raw
And so,
sex.
raw sex.
I like the way it sounds. Raw
Exactly.
sex.
And as you know, the Counter Narrative Project is, we're very sex positive. So it's a value that we hold very strongly. And that's how we're going to frame this discussion. All right. So what is raw sex?
Well, raw sex for me and the research that I'm doing is, of course, condomless sex. Um, but it's also about what I'm calling a form of deep intimacy that Black gay men engage in, and also semen exchange or busting nuts inside each other.
David Milbranch would appreciate that candidness.
Or there are things it's called taking the kids.
Wait, taking the kid. What does that mean?
Well, that's the kind of eroticization of nut, and infusing like kids in it. It's actually quite hot. When you are engaged in raw sex and your partner asks where you want these kids, and you say give me these kids. So, and and a lot of this language, a lot of it circulates in porn,
Mm-hmm.
but also in my research, because I've conducted a Center for AIDS Prevention Studies sponsored pilot study of raw sex practices among Black gay men. And it was actually called the Raw Sex Project.
You called it that?
Called it that.
Wow.
And in Indianapolis and Detroit.
Was it like an acronym or?
No, it was something catchy.
Okay,
but
it is catchy.
but it was that was what it was about, raw sex, and it was part qualitative interviews, part ethnographic, and so it also involved Black gay men engaging in not only one-on-one raw sex and or unprotected sex and semen exchange, but also group sex, and so. This was some of the language that what my participants would describe as what they like to do and to say about what they do.
Now I imagine that there are folks, particularly folks that might work in the field of HIV prevention, that are probably hearing you say this and are might feel a little alarmed actually about researching raw sex and being kind of almost like objective about it. What if what's one thing that people working in sexual health should know about raw sex and black gay men that they might not already know or might not be very familiar with?
The main term that I would say, it's complicated and complex. So my approach to sexuality research is that I come at it from a variety of perspectives, and I also focus heavily on how Black gay men talk about their relationship to sex,
Mm,
what Black gay men want, why do they do what we do, right? How does raw sex actually give us pleasure, but how it, in some instances, connects us in a deeper way with our partners.
mhm.
And and this is one of the things that I explained to my colleagues when
Mm.
I first introduced this project. And they were, some of them, they were clutching pearls, but some of them were. And actually, there was this interesting thing that I did because I used a Adam for Adam profile
Huh.
of a anything goes. And so
Okay.
I talk about this whole category of anything goes as supposed to signify
Mm.
raw sex or anything goes. And most of the time, that's what that means, right? And they, of course, they didn't quite know what that meant. So I
So
explained
wait, you
to
got to
them.
paint the picture. So what
So,
your colleagues, what
so we're in
backgrounds?
a room like this,
Okay,
and
kind of like a conference room.
right, and at the beginning of the session, we have at the beginning of the summer session, we
Mm.
have what they call science chats.
Okay.
And my science chat, I had projected a profile
Wow.
that it had, 9-inch dick size, and I just watched everybody around the room just clutching pearls. It was just like a whole dance, and they were just, oh, ooh, ooh, and there was one of my mentors. She was like having a great time watching everybody else
Wow.
clutch pearls. But it had on there, and it's a profile that I highlight and analyze in the article, an essay that I wrote on called Black Gay Raw Sex. And I'm capturing a one way that Black gay men talk about their desire and talk about what they want in terms of
Mm.
sexuality, or in terms of sex practice. And I see it as a way to claim a kind of autonomy, or sort of reclaim a kind of control over our own sexuality that often, in my view, has been taken away by the overemphasization in public health discourse on HIV and HIV prevention, as though HIV should deny us, whether you are HIV positive or the risk thereof, should deny us the actual pleasure in sex and actually having the kind of sex that we want.
Do you think in 2018, black gay men still carry a lot of fear with them when they have sex?
Absolutely. I think, and this is why this research for me is really important. I think we are taught that is not only is gay sex wrong,
Mm.
black gay sex is wrong because there's a racial dynamic to that, in my view.
Mm.
But we're also taught that because of our disproportionate and the disproportionate vulnerability to HIV, we are taught that there's only a certain kind of sex that we need to have.
Mhm.
Many of us are having all kinds of sex. The issue, I think, is that it's not, we don't have a literacy for talking about what we want and what we
Mm.
desire. In my view, if we can't talk about what we like, what makes us feel good, what brings us pleasure, we can't then talk about how that works within a whole sexual health
Mm.
framework, right? So there are ways in which we can be risk reductive
Mm.
and still have pleasurable sex.
Mm.
There are a variety of ways that oftentimes providers don't even talk about it because um, it's a condom use only kind of thing, and we know that everyone does not always use condoms when they're having sex.
I remember several years ago, this might have been back in 2007 or something like that. I organized a panel on barebacking at like Black Gay Pride. I was a workshop coordinator or something that year. And I had this panel of porn stars and outreach workers. It was like I guess my vision was to really bring people together.
Hmm.
It was something else. I remember, but I was terrified because I was like, oh my god, they're gonna run me out of town. Because back then they even talk about condomless sex without framing it around fear, without framing it around pathology, without framing it around um, risk.
Hmm.
It was dangerous work, and people would get very, and I get it, right? I think some of it's rooted in trauma,
Hmm.
but yeah, people would be really cruel. But I mean, ultimately, it was really successful. And what I realized is that a lot of us, we really do want to be able to have conversations about sexuality that center pleasure.
And I was in the research that I did, and we conducted this. My team and I, we conducted this research in 2014, and we interviewed. It was a pilot study, so we interviewed 20 Black gay men, 10 in each city, who um, admitted to having raw sex at some point in their life, in
Mm,
different kinds of raw sex. And then we had four Black gay men, two in each city, that um, we gave them a observation guide, and they would go when they would go to sex parties or sex clubs. They would, after they would have an they would already go to those, so that we just wanted them to, after they came from that experience, to use the observation guide to talk about what it smelled, what the space smelled like, looked like, what people
mm.
would say. And some of the times, some of the language that, like, give me them kids, or, all of that would be said, at least from their perspective, that would be said sometimes within these spaces. But what we found is that Black gay men have, a range of strategies that they pursue, and they have, in some cases, a kind of sophisticated way to decide on with whom they will have raw sex, when,
Mm.
under what circumstances, and what circumstances they won't. And then some people, they engage in raw sex because condoms actually prevent performance, but also gets in the way of a kind of intimacy, not just the sort of skin to skin, um, you know booty hole heat that they want to feel around their
Is that
dick,
that's the scientific
right?
term, booty hole heat,
Booty
right?
hole heat. I was gonna say anal, heat and pleasure, what, but and also wanting to feel the dick inside them pulsating. I mean, one guy, one of my interviewees, one of my participants, actually described what it feels like when a dick is inside him, and the dude is coming. He can actually feel the dick
Mm.
pulsating inside him, and he said that turns him on. And he, like, lives for that. So what I wanted to know, instead of approaching these men with judgment and saying, with this whole finger wagging, you shouldn't be doing that, whether you are HIV positive or not, because that is also another layer of stigmatization, right? And fear. I wanted them to be able to articulate why they like what they like, what it makes them feel like, what it means to them in their
And let me
lives.
just say that I think it's very revolutionary to ask Black gay men, what do you like? What brings you pleasure?
Yeah.
Because we're often not asked that. We usually ask, what are your risk behaviors?
Right.
And it's like, I mean, even the kind of
And it's always
questions,
defined in risk and
mm-hmm, and
pathology, and not
fear.
right, and not defined in pleasurable terms. And so many of my participants, and even my team members who interviewed these
Mm-hmm.
men, they said that sometimes, and I experienced this when I interviewed some of the men too. They When we would get into the interview, and I would start asking them questions, and they would stop and say, "Wow, no one's ever asked me that
Yeah.
before. No one's ever asked me what I like, what
Mm-hmm.
brings me pleasure, what makes me feel good, what aspect of sex makes me come, or why do I come, where I want to come, how I want to come." No one has
Mm.
ever asked them that. And just think, if a provider would approach a Black gay man in that way when he comes to see when he comes seeking services, whether they be prevention services or treatment. Think of the different kind of experience
Because when you
that
get
they
an
might
HIV
have.
test, they start asking you, what are your risk behaviors? Who have
Right,
you slept with?
right,
And so the sex is framed around risk, but not around pleasure,
right.
not around desire, not around meaning, but around, risk and fear. And I really believe that you internalize that. I mean, so many of us, before we experience sexual pleasure, we experience fear.
Yes.
And it actually takes us a long time to get through and
Yeah.
almost decolonize ourselves from the fear to be able to get to pleasure if it's ever
Yeah.
possible. Um, but I do want to talk. I want to kind of bring it back to health a bit,
Mm-hmm.
but in the context of emotional health and emotional wellness.
Mm-hmm.
One of the things that I'm curious about is, on the surface, there is a heightened intimacy that happens with condomless sex or raw sex, as you say.
Mm-hmm.
But is it really though, or is it just a perception of intimacy? Is it the only perception of closeness?
So I think all sexual interaction has a level of perception.
Mm-hmm.
It's what you tell yourself, um, and how you make sense of a particular kind of experience. And oftentimes, it is over the lifespan that you accumulate experiences and you attach meaning to those
Mm-hmm.
experiences, and those meanings create desire, right? So
Mm-hmm.
this is when I teach I don't want to get too academic, but when I teach
I
my
told him not to get
classes,
too academic.
when I teach my classes, I try to disabuse my students of thinking that desire is inherent, that it's not constructed, that there
Okay.
is that it's purely inherent,
Okay.
right? That desire is about our experiences and the meanings that we associate with experience. So
Hmm.
if we, and sometimes those meanings are contradictory,
Mm-hmm.
or taboo. The so there is a way in which we like things that are taboo or that are prohibited, that makes it hot. We like things that are risky because that also makes it hot.
Mm-hmm.
It adds to it. But in terms of intimacy, what I found that my participants had, and interesting because we think about these things, no?
Mm-hmm.
So they would say, well, sometimes I would only have raw sex with someone that I'm in a relationship with,
Mm-hmm.
or I want to be in a relationship with, and I want to get closer to them. And there's a special feeling that I get when I know that a part of them is inside of me without any kind of barrier.
What's the feeling?
A feeling of, and what I'm referring to as deep intimacy, because I'm still trying to figure out what is the best term to capture it,
Mm-hmm.
because I don't think we have
I'm
an
like
appropriate
happy,
literacy.
sad, angry.
No, it's a feeling of closeness. And so
Okay.
how I analyze it is that Black gay men move through the world often not having the experience of closeness with other Black gay men, or fear, or with
Mm.
other men, period. A
Yeah.
feeling of distance, of barriers, because
Detached.
detachment,
Yeah.
the inability to trust because of trauma, because of a variety of ways in which we have been hurt by our families
Well,
and
that's
by
something to
other Black
consider,
gay
right?
men.
So if we are to understand that trauma can live in our bodies, like there can be physical manifestations of trauma, then what does that mean for how we are intimate? What does that mean? So when we're intimate, what do we do with the trauma that we carry with us?
So so one of the things I believe is that the intimacy helps to affirm us.
Mm-hmm.
Um, it helps to add what the trauma has taken away. And part of the trauma, what the trauma takes away for some Black gay men, is a sense of value,
Mm.
is a sense of self meaning, self value, connectedness, and it's about the physical connectedness that
Mm.
is not only about sort of skin to skin and body to body,
Mm.
but it's about fluids. It's about a
Mm.
way that we add meaning. Some men add meaning to exchanging of fluids, particularly the way in which nut has all of this meaning and
Mhm.
symbolism. It represents, it represents a lot of things that
Mhm.
we add to it, we place on it. And so,
Which is probably related to the language around referring to as kids because it
right,
suggests procreation and
exactly.
like a primal sort of thing.
So one of my
Hmm.
and it's also not, it's not, so the intimacy is not also not always about sort of a long-term extended intimacy. Some of it is about ephemeral intimacy. Some of it is about
Mm.
moments, having this moment where you're not necessarily connected to this guy in any kind of emotional way beyond the sexual act. But in that sexual act, you get you have an experience that's kind of, ephemeral, but it's wow,
Kind of like a
and
liminal
a
space.
liminal space, right? And again, that contributes to the eroticization of the act of raw sex and also the act of semen exchange. So the reason why, when you ask me what term I would use or how I would
Mm.
describe what raw sex is, I would say complicated and complex because it has different meanings for different men.
Mm.
One guy that we interviewed in Detroit, um, he calls himself Raheem, and I talk about him in another piece that I've written. He would go to sex parties and he would have raw sex and what he said, bust nuts inside multiple men.
Hmm.
And so I asked him, I said, so why do you do that? What do you get out of that? And he said, it turned me on to know that all these men will walk out of that party with my nut inside them. That made me
Okay.
feel some kind of way. Now, the other aspect of the interview, and I am not a psychologist. I'm many things, but not a psychologist. But the other aspect of the interview, I talked to when I asked him, I asked him about his family and his
Hmm.
relationship, and he talked about not feeling value, not feeling value amongst his family, not feeling desired by men,
Hmm.
particularly black men, right? So I got a sense that this gave him a sense of power,
Mm.
and a sense of power that he associated with value. Right?
Mm.
So if I can nut into as many men as I want, if I can. One time he went to a party. He said he fucked 8 men raw, nutted up in about 6 of them, I
Wow.
think. And
So our friends in public health are probably falling out. Like I'm
right,
sure that
right.
half of them fainted.
And at the
So the
time,
question, so I would.
he was at the time of the interview, he reported as being HIV negative.
Um,
So
so I guess my question would be, so there could be someone watching that might, I don't know, work for some health department or even the CDC. And so like, let's say they're crafting some RFP
mm-hmm,
around HIV prevention, testing, and treatment.
mm-hmm.
What do they need to know for them to craft an RFP, a request for proposals, like the thing that people apply when they're applying for grants?
Mm-hmm.
What would they need to know? What would they need to put into that RFP so that people can better respond to the sexual culture of Black gay men as it exists?
And here's part of my struggle is that I think it's hard to get public health, and I suggest that people should continue to try it. I know I do,
Mhm.
to be interested in funding projects that are about enhancing Black gay men's sexual health and wellness
Mhm.
from multiple perspectives.
Mhm.
One important thing is literacy. Black gay men need to be able to develop a literacy to talk about desire,
Mhm.
right? To talk about pleasure. Because one, that is pleasurable. It is
Mhm.
pleasurable to talk about pleasure, to be able to articulate what is pleasurable. Two, the literacy allows for you to be able to negotiate risk, right?
Mhm.
So just because so risk should not be always seen as bad and backward and pathological and dangerous in
Mhm.
per se. For many men, for many Black gay men, risk is high. But there are ways in which you can negotiate risk. There are
Mhm.
ways in which you can have certain kinds of sex with this person. Maybe y'all got tested together. Maybe you all know each other's status. Maybe maybe you are serial sorting, or maybe you are engaging in strategic positioning, or issues around anal care, making sure that you are you don't have other accumulation of other STDs. I mean, so there are a whole range of ways in which maybe reducing your partners. Maybe you should nut up in everybody and you can nut up in one person. So there are a whole range of ways in which um, if we can talk about what we like and talk about what we like to do, then we can actually have a literacy so that the service provider, the practitioner, can engage us on, okay, this is an overall sort of range of things that you can do that does not totally compromise, or that doesn't compromise at all the whole pleasure purpose of sex. At least I think that it's about pleasure and desire, while at the same time engaging in risk reduction. And Black gay men also need to feel comfortable to say to anyone, condoms don't work for me. I can't perform in condoms. I have difficulty performing with condoms. Condoms really
you think there's still, are people still being condom shamed though if they don't use condoms? There's still a lot of finger wagging.
I think so.
Okay.
I think so. I think that there is still a stigma, even with PrEP and all of that.
Because even with PrEP, a lot of times they'll say use PrEP, but also use condoms. And I've always thought that messaging was so curious to me, because it seems like if you're using PrEP, well, I mean, I guess they also feel, because there are other STIs that want. So I mean, there's a range of reasons why one might want to use PrEP and also use condoms, but it's just interesting that so much of the template messaging does suggest that.
Yes, and I think that is an issue, and there are a whole range of other structural issues that impact Black gay men's sexual health that make us, disproportionately vulnerable to other STDs and STIs. Part of that is if we don't feel comfortable going to service providers, we can't engage in testing and knowing what our STD and STI status are.
And there are also just, in general, so many barriers to accessing healthcare to begin with.
Absolutely.
One of the counter-narrative project, our analysis is that we have to not focus singularly on individual behavior, but look at holding institutions accountable.
Right.
Because so many institutions that we go to seek healthcare, to seek wellness, are often, if not hostile to us, at least erect so many barriers that it makes us just, the sort of process of even navigating the institution is just really difficult. But I do want to ask one final question before we are out. And that is, in the course of your of your amazing research, what did you learn about yourself? What are some things you learned about your own sexuality?
I learned that I like raw sex. Wow. Not all the time. Well, I shouldn't say that. I learned that I accepted the contradictions in my desire, or the way in which my desire is sort of rooted around certain need for intimacy and closeness with some people, but not all, right? And that I also learned that I engage in a sort of risk reductive, but not total risk elimination. I negotiate risk in terms of my sexual practices. And I've also learned that over time, there are certain things that I totally would not do.
We'll have to talk about that. We'll have to talk about that in Revolutionary Health After Dark. So stay tuned.
Right. That I do now.
The late night version.
And it's interesting too, because for me, so my complexity, my perspective on sexuality as being complex is in part because of my own realization of the complexities of my own sexuality.
But is it complex though? Like, it's
absolutely.
At the end of the day, is it really that complicated?
Absolutely, it is. It's very complex, and I think that we do ourselves a disservice when we decomplexify sexuality by suggesting that everybody should do sex means the same for everybody.
That there's a template that everybody has to follow.
Exactly.
Which was such a disaster for much of the sexual health landscape over the last few decades, this assumption that, sex is rational, that it's,
Right.
you can just follow a checklist of things, and realizing that people have, like, as you shared, very different relationships, and they attach different meanings to their bodies, to
Yep.
pleasure, to sexuality.
And they have different people have different needs. Sex serves different purposes for
Mhm.
people. So it's really complex in the way, in my view, the way that we um, get at the complexity is that we allow Black gay men to talk about it.
So I definitely think the take home that I'm hearing is that we need to continue to centralize pleasure, in discussions around sexuality. If
Absolutely.
and that's just the way forward. Ultimately, that, to be free is also be to have freedom in our sexuality,
Yep.
and that we may not be there yet, but we have to keep at it. Thank you so much for joining us.
Thank you.
Again,
This was great.
please like us on Facebook. If you're watching this on YouTube, please subscribe to our YouTube channel, and please join our email list at thecounternarrative.org. And Dr. Marlon, if people want to follow up with you to learn more about your research, how would they find you?
So my email is marlon.bailey at asu.edu. I teach, I'm an associate professor of women and gender studies at Arizona State University. You can look me up
Perfect.
there. You can find me on Facebook, Marlon M. Bailey, Instagram, Marlon M. Bailey. My book, you can get it on
All right, book.
Butch Queens Up in Pumps, Gender Performance and Ballroom Culture in Detroit. You can get it on Amazon and University of Michigan
That's
Press.
a good book.
So plenty of ways. Email me. I try to respond to everybody's email.
Do you, like, if
At
somebody's
some point,
thinking about having raw sex, can they
well,
reach out to you about for advice or
I don't
suggestions?
want to tell people what they should do, but if they want to become part of my research, maybe.
All right, everyone. Thank you so much. Special thanks to our crew, Johnny Carnegie and Alvin Agarat. Thank you so much for handling the production and sending positive energy to our David Melbranch. As you know, he wasn't able to join us this week. He is
David.
actually moderating a discussion with Darnell Moore, a friend of County Narrative Project, who is in town for a book event. So thank you so much for joining us. And as always, please continue to um, just center joy and power and pleasure in your life. Thank you.
Thank you.